Happy day to all. Welcome to Physiotherapy Competitive Exam Series. Contact details for license exam crash course are given in the description. Which of the following is not an electrolyte ion? A. Sodium, B. Chloride, C. Magnesium, D. Phosphorus. The correct answer is D. Phosphorus. Sodium, magnesium and chloride are all electrolytes. Phosphorus itself is not an electrolyte, but phosphate is an electrolyte. What is the most effective method to evaluate the true internal range of motion in the glenohumeral joint? A. Assess the motion with arm at the side. B. Have the patient place their hands behind their back. C. Evaluate the motion with the patient reaching their hands behind their head. D. Assess the motion with the arm abducted at 90 degrees while the patient is in a supine position. The correct answer is D. This position optimally isolates the glenohumeral joint and allows for a more accurate measurement of the internal rotation without compensatory movements from other joints such as the scapulothoracic joint. Abducting the arm to 90 degrees minimizes the influence of surrounding musculature and provides a clearer assessment of the joint's true range of motion. A physical therapist is evaluating the skin condition of an elderly patient recently referred for therapy. Considering the typical age-related changes in the integumentary system, which of the following conditions is not a concern for this elderly patient? A. Bruising easily from minor injuries. B. Risk of heat-related illness. C. Susceptibility to skin infections. D. Faster wound healing rates. The correct answer is D. Faster wound healing rates. Wound healing rates actually decrease with age due to thinner, less resilient skin, reduced fat layers, vascular changes, and weakened immunity. This results in wound healing 4 to 5 times more slowly in older adults, increasing the risk of pressure ulcers and infections. Elderly individuals may also bruise more easily because of thinner and less elastic skin, and they sweat less due to decrease in sweat glands, affecting their ability to regulate the body temperature in heat. Stretching exercises enhance joints flexibility and range of motion. Which type of stretching incorporates quick, forceful, and intermittent movements at high speed and intensity? A. Ballistic stretching. B. Manual passive stretching. C. Self-assisted stretching. D. Mechanical resistance. The correct answer is A. Ballistic stretching. It involves forceful, rapid, and intermittent stretches typically used for athletes and younger individuals in rehabilitation. Self-assisted stretching allows patient to perform stretches independently, while manual passive stretching involves applying an external force to move a specific body part beyond resistance and available range of motion. I hope this video would have been useful to you all. For more such videos, stay tuned to our channel. Thank you.